Hey, good afternoon, everybody. This is Dave Johnson, and our moderator today is Sandy Moretta, our senior specialist from Information Technology. And joining us as speakers are Melissa Allman, senior specialist of Advocacy and Government Relations, Dr. Kyle Quigley, our director of Veterinary Medicine and Surgery, and Jim Kessler, director of Instruction and Training. We're meeting today because the Centers for Disease Control have a new dog rabies regulation going into effect on August 1st, and it creates some challenges for guide dog handlers. And we're here to discuss the ramifications and not really to debate the egregiousness of the regulation. The situation is very much in flux at the moment, and for a number of reasons, which we're about to discuss. I'll start by saying that within the last, I'd say, half hour to an hour, the CDC has changed the regulation, which helps us a little bit, but doesn't get us out of the situation. So you should all know that this situation and this regulation came about because rescue groups were importing dogs from parts of the world where dog rabies still exist. And either vaccine protocols were not followed for some of those dogs, or the paperwork was falsified. And unfortunately, some of the dogs had rabies and infected veterinary caregivers in the US. We are talking about the dog rabies variant. I know a lot of people are going, but there is rabies in the United States, but it is particularly the dog rabies variant that we're speaking about here. So I'm going to pass it along to Melissa Allman to go into the regulation a little bit and talk about where we're going with this, okay?
All right. Good afternoon, everybody. Somebody let me know, Dave, if I can't be heard. I think, can you guys hear me okay?
Yes, ma'am.
Okay. So I'm going to start out very briefly by talking about how things are now and how we can expect them to change. So as it stands right now, if you are traveling internationally, we suggest that people, unless they're going to Canada, we suggest that people reach out to their USDA accredited veterinarian and find out what the export requirements are for that particular country. So in many cases, and they vary, so in many cases you have to get the international health certificate for the places that you're going, and then that has to be done by a USDA accredited vet, and usually that has to be endorsed by the USDA and then sent back. So it takes a little bit of time. And I think any of you who travel internationally on a regular or even a semi-regular basis know that that process is convoluted at times and costly also. Okay. So that, that really has always sort of been the case. But for Canada, generally, we have advised people going between the US and Canada to have their rabies vaccination on them somewhere, because Customs and Border Control can ask for it. Sometimes they do, sometimes they don't, but you want to make sure that you have it. Okay. So that's how things stand now. The purpose of this regulation, though, by the CDC, which takes effect on August 1st, the point of it is to cut down on the possibility that dogs entering the United States with dog variant rabies will bring it in. So what the CDC has said, and there have been some changes to this in the past 20 minutes, is that all dogs returning to the US from either a low risk for rabies or a rabies-free country or a high risk country for rabies, either coming back to the US from here, if the dog was vaccinated here, or visiting the US, have to now comply with additional requirements, regardless of whether the dog is coming here by air, land, or sea. And that includes Canada. Until about 40 minutes ago, what that meant is that if you were coming to the US, let's just focus on low-risk countries for now, even if it was Canada, and even if you were just driving across the border, you had to get a rabies vaccination certificate, and it had to be endorsed by the governing body of the country where the dog was vaccinated, which basically meant that you had to spend several $100s getting your vet to fill this, your USDA accredited vet to complete the paperwork. And it had to be endorsed either by the USDA if the dog was vaccinated here, or by another country, depending on where the dog was vaccinated. Now, some of that was relaxed a little bit for Canadians a couple of days ago, because in Canada, you can now, the Canadian health minister has worked very hard on this. So if you're coming from Canada and your dog was vaccinated there, you can just have a form that's completed that does not have to be endorsed by the Department of Agriculture, and you can use it to enter and re-enter the US for as long as the dog's vaccination is good. Okay, but here is what also applies, and this is the sticking point, and then I'm going to back up a little bit and talk about the new thing that just happened. All right, so regardless of where you're coming from, if you're coming to the US, you have to complete a CDC dog import form. The CDC dog import form requires you to provide information about yourself. For example, whether you're the owner of the dog, whether or not you're the flight parent, whatever. And this doesn't matter if you're traveling by air, land, or sea, or just riding across the border, okay? It requires you to put in your dog's microchip number, your dog's age and date of birth, your passport number or driver's license number, which, you know, for most of us, it's a state ID or a provincial ID, depending on where you live. All right. And then you have to upload pictures of your dog and make sure that the dog's head and teeth and face are showing. Why this dog import form is so problematic is because it is not meeting what we call 508 accessibility standards. 508 of the Rehabilitation Act is the part of the law that requires federal agencies to make their stuff accessible. I and others have attempted to do the dog import form that the CDC has provided on its website, and it's very difficult at best. If you're a very advanced screen reader user, you might have a little more luck with it. I personally found that I thought that I was, for example, when I was selecting birth dates and things like that, I thought that I had successfully selected things, but then was told by a sighted person that I had not actually selected what I thought I did, even though it moved me up to the next field. And there are just all kinds of problems with it. We reached out to our accessibility consultant that we work with internally just to make sure that it wasn't just, you know, because I am not a tech expert, but I am also a competent screen reader user. And we wanted to make sure that the people that were testing it, that we weren't really, we were giving accurate information. And so our accessibility consultant said that this form has pretty serious problems as well. So that is something that no matter whether you're going to have lunch with your kids across the border, or whether or not you're taking a trip for a few days, or whether or not you're flying, or wherever you're going and coming from, that requirement with that form that has accessibility issues has not changed. What we just learned changed, like right before this webinar, is that if you're coming to the US from a low risk rabies country, so Canada obviously is one, and that's an example. I'm going to fixate on Canada a lot because it's a place that's been pretty easy to travel to and from. So because you haven't had to do international health certificates or anything. So if you are coming from, if you're coming back to the US from a low risk country and there aren't other import requirements like international health certificates, like you're just coming from Canada, for example. Now you just have to do either a verbal or written attestation that your dog is vaccinated for rabies. We have not had an opportunity to dive into that deeply enough, or aren't even sure that the information is there enough to know who will take that verbal or written attestation, if, you know, they do it at customs, or how that's going to work. So that removes one of the barriers that was going to be placed on people with, oh, and I should have said earlier, and I'm sorry that I didn't, but the reason we're talking about this is because the CDC has made no exemption for people with service animals. They've been very clear that they will not make an exemption for people with service animals. We are pushing on them, and I'm going to talk about that in a couple of minutes. But anyway, so there's going to be this verbal attestation that your dog's vaccinated for rabies if you're coming back to the US from Canada, or you're visiting the US from Canada, for example. And I'm sure it applies to other countries as well, where you would also have your standard health certificates that you'd have to do to get into those countries. But this doggone CDC dog import form, it appears, is not going away. It's free, and all you have to show at the border is the receipt that you've completed the form. And so presumably, if you're sighted and you have 3 hands, I don't know how many people do, and you can effectively take those pictures of your dog, you know, presumably you can save them somewhere and use them again. But accessibility is a big issue here. So at the border, you would just show the receipt that you've completed the form. Another developing aspect of this that has also, we've also gotten some updates just this morning, is that airlines were saying that they had no way of complying with the regulation, because the new regulation requires airlines to have an airway bill, which essentially means it's an airway bill is something that the airline fills out to track goods that are being shipped. And it's a legally binding document between the shipper and the airline. And that has never been a thing for service animals that are being transported in the cabin, because it just doesn't make any sense. But the CDC was saying that airlines were going to have an airway bill for dogs in the cabin. So what we were hearing from airlines was, well, since there's no process in place, and this is taking place on August 1st, we're just not going to be able to fly service animals internationally, because we have no way of doing it. And we know that by not doing it, we're going to be violating the Air Carrier Access Act and discriminating against people, but we don't really have a choice. So as a result, the CDC has provided airlines with some information that they are allowed to request an exemption to doing the airway bill. And we know for a fact that British Airways is going to be requesting that exemption so that they can fly service animals. And it's every airline can individually apply for that exemption. So I think that if you're traveling internationally and you're told by the airline, we don't have a way to fly your service animal, and they haven't applied for the exemption, I think you can still file a complaint with the Department of Transportation against that airline, because now they have been given a way to comply with the regulation. So that's what I can say about that. What I can also say about our advocacy efforts is that we have been banging on doors, calling, writing. I am a member of the Legislative and Advocacy Committee for Assistance Dogs International North America. We have written a joint letter to the CDC and the director, the head veterinarian, Secretary Becerra of Health and Human Services, asking that they make an exemption for service animals, at least those accredited by ADI and IGDF, the International Guide Dog Federation. The International Guide Dog Federation has written a similar letter to the CDC. The Seeing Eye itself has reached out to members of Congress, and we've gotten some help from graduates who work for members of Congress. And so we give a shout out to those individuals. and have expressed our concern. Senators Klobuchar and Collins have written a letter to the CDC, and we were exploring whether or not we're still exploring this, and I can't go into a lot of details about this, but we're exploring whether or not there are some legal claims in the area of civil rights, depending on how all of this shakes out, that can be brought. So those are some of the advocacy efforts that we have been engaging in, and the airlines also have written letters to the CDC asking for an extension and a postponement on the regulation, not just for the purpose of having a new date and kicking the can down the road, but for the purpose of actually getting them to give us time to work together to figure out how this regulation can work, and partner with industry partners and service animal organizations to figure out how we can keep this from being a burden. So where it stands right now is that, to summarize, that the CDC has relaxed a few things, right? They've made it a little easier for people with dogs vaccinated in Canada, which we really appreciate for our Canadian graduates. So that's one thing they've done. They have told airlines you can apply for an exemption for the airway bill. That's another thing that they've done. And now they have said that if you're coming back to the US from a low-risk country, all you have to do is attest that your dog was vaccinated for rabies, and it can be a verbal or written attestation. But we're still stuck with the inaccessible CDC dog import form. And I think so. The sense that I'm getting is that and I might be wrong, so I want to say that very clearly. The sense that I'm getting thus far is that the CDC has heard loud and clear that there are barriers that they need to address, but granting either one, an exemption for people with service animals, or two, a postponement so that things can be worked out, those do not seem to be things that they have agreed to thus far. So that's what I have to say. And I'd like to now turn it over to Dr. Quigley to discuss more details about the forms that I'm sure I have not covered. So thanks a lot.
Hello, thanks, Melissa. So I just wanted to, back up and just cover a few topics broadly, just so we all are on the same page as far as what's going on, and then we can get into some of the specifics. So this is a new regulation put out by the CDC because rabies is the dog disease in dogs that's covered by human health. So everything pertaining to rabies is covered by human health organizations as far as the duration of immunity, the rabies certification process. Everything is designed to keep humans from being exposed. And as Dave was saying earlier, that's what happened here. Dogs were brought into the country with rabies, and they exposed a lot of humans. So that was what the problem was that they were trying to address. The other issue is the different variants. There are different variants of rabies. They all cause the disease of rabies, and they're all close to 100% fatal. As far as the common variants that we're talking about here. So dog rabies variant, the dog rabies variant has been eliminated from the United States back in 2007, and they're trying to prevent it from coming back into the United States. The common types of rabies, the variants that we have in the United States are typically bat, skunk, and raccoon rabies. So that being said, the biggest hurdle, as Melissa was saying, is this new CDC dog import form. So if you're traveling, I always recommend giving yourself at least 3 to 6 months to plan accordingly. If you're traveling internationally, you still need to fill out a international health certificate based on the requirements of the country you're going to. And then as you return, you'll need a CDC import form. And that's for international travel past, not including Canada. So nothing has changed there other than you'll need the CDC import form to get back into the country. The other issue is high risk versus low risk countries. Just broadly speaking, there's lists online that you can always look for the specific country you're going to, but just broadly speaking, as far as regions go, high risk countries are in Eastern European countries, Africa, South America, and some parts of Asia. So if you're not going to those regions, you can always double check to make sure you're going to either a dog rabies variant free or low risk country. If you are going to those regions, you do want to check the country you're going to see if it is a high risk country. Those lists are available on CDC's website. All right, so the International Health Certificate is taken care of by the USDA. You will need a USDA accredited vet for the International Health Certificate. So if you're traveling anywhere other than Canada. Not all vets are USDA accredited. So you want to make sure you find a USDA accredited vet to work with if you are traveling internationally. All right, so now to Canada and the other countries as far as the CDC import form. So you'll be able to find this on the CDC's website. If you just Google CDC dog import, you'll get to their website and to the general area where you'll be able to find several different topics related to importing your dog into the US.
Kyle, I just want to jump in and mention that we created an easy way to get to this page on our website. So if you go to seeingeye.org/CDC, if you put that in your browser, seeingeye.org/CDC, it will take you directly to the page on the CDC website that Dr. Quigley is talking about. Sorry, thanks. I just didn't want to forget.
Excellent. So once you're on their website, you'll be able to find the form. You'll also be able to, address any of the questions you might have. They have a lot of information on here. Some of the big things are how long is the CDC form good for? So as long as you're traveling to a dog rabies-free or low-risk country like Canada, it is good for 6 months. And you can reuse it to get into the United States several times or as many times during that 6-month period, as long as you do not travel to a high-risk country. The basic requirements that the dog must be over 6 months of age applies. The dog must appear healthy when it arrives, and the dog must be microchipped always apply. So it's good for 6 months. You can use it multiple times. The owner of the dog is who's completing the form. You do not need a USDA accredited veterinarian or any type of veterinarian. There is no cost associated with the CDC form. And as far as when it should be completed, if you're using it for that 6 months, as long as you're using it during that 6 months, that's how long it's good for. If you plan on traveling, you can actually do it the day of travel. So there's no, you don't have to have it submitted several days ahead of time or 10 days ahead of time. Like in international health certificates, you can do it the day of travel, or you could do it, 5 months before you travel, as long as you're able to use it within that 6-month time frame. You will need to be able to show the receipt that you submitted the form. The receipt can be printed or shown on the phone screen to U.S. Customs officials or the airlines if they're asking for it. And I think, so I just wanted to walk through one of the forms with you just so you can get a sense of what's on it. I know Melissa covered most of the topics. I was just going to read you line by line. So the first question is, has your dog been to a high-risk country in the past 6 months? And at the top of the form, there's a link to high-risk countries to make sure your dog has not been to one. Then it's going to ask for the owner's name. So your name, first name, last name, and the person listed above is the owner, the shipper, the flight parent. I don't know what exactly that is, or somebody else. So you can select the owner. The identification type, this is for you. So your passport number or driver's license number and your date of birth. Your email address and your phone number are also required, as well as the physical address where the dog will be located in the United States. The next section is about the information regarding the animal. So your dog's name, age, as far as years and months, the sex, the breed, and color and markings. The importation purpose is going to be service animal. So they have personal pet, commercial, government-owned, education, and service animal. So you can select service animal. And then section C is travel information section, but there's nothing to fill out. And section D is the signature. So it just make sure that you're complying with, and with their regulations, and you understand that you're complying with the CDC import rules and regulations, and your signature and the date that you signed. And then you click submit and it's submitted. Once you get receipt, that is what you're going to be showing either airline or customs officials upon travel. Melissa, would you want to add anything there, or?
No, I think that was a really good explanation of that, and I'm glad we have you, because I will admit freely to, given how convoluted this has been, I thought that you had to do the CDC dog import form every single time you came back to the US. Excuse me, if you were like going across the border, you know, between the US.
I think that might have just been changed today, because
okay.
I was under the same impression. But there is a line right here that can I use the form's receipt multiple times? And it says the receipt can be used for multiple entries into the United States as long as the dog has not been to a high-risk country in the past 6 months. So I believe.
Okay, yes, that was not there yesterday. It's true.
Yeah.
All right. So what I would like to add then, before we turn it over to Jim, to talk about anything concerning dogs coming back to the US from Canada, is that be patient with us, because we are in this with you and things are constantly changing. So I stated today that the form has some accessibility issues. It would not surprise me if the CDC has become very aware of that. And it wouldn't surprise me if I or you go back on there and see that there have been some improvements to that form. I'm going to be optimistic and believe that that's going to happen, because I really think that they want us to go away. So that's what I mean by things being in flux. That's the only thing I would add before, unless Dr. Quigley, you have anything else before we go ahead and turn things over to Jim.
No, I think that covers it. On to Jim.
Okay, well, Dr. Quigley, don't go too far. Now with everything in flux and what's going on, how, taking into consideration the new revelations here, how would that impact if somebody from the seeing eye, like an instructor, had to go to Canada and bring the dog back via, whether it's for the dog was going for retraining or the dog was getting picked up because they released owners with the dog back to the seeing eye? How would that impact a seeing eye employee getting a dog as opposed to the graduate just bringing the dog back? Do you understand what I'm saying there?
Yep.
All right.
So it's a vast improvement from what it was. I think now the instructor could fly to Canada upon picking up the dog. The instructor would be able to take the photos and fill out the import form, and theoretically be able to travel, as long as he can attest to the fact that the dog has not been to a high-risk country in the past 6 months.
But wouldn't they also need to, this is Melissa for anyone who isn't sure, but wouldn't they then also need to, the instructor would also need to have some level of vaccination information
Right.
about the dog, because they need to be able to test that the dog was vaccinated or something. I think that's the new thing that just happened 20 minutes before we started this. Am I understanding that correctly?
I'm just gonna pull it back up here.
He's looking on his computer.
Yeah. From August 1st onward, entry requirements for dogs from dog rabies-free or low-risk country. The one form you will need is the CDC dog import form if your dog has been only in countries that are dog rabies variant free or low risk in the 6 months before entering the United States. Your dog must appear healthy to enter the US. Recent changes. This is your CDC values your feedback paragraph, and then starting on August 1st, dogs entering or returning to the United States that have been only in dog rabies-free or low-risk countries in the past 6 months must meet the following requirements: be healthy and complete the CDC dog import form.
I'm going to throw a question in there.
Yeah, I think it's always good to travel with a rabies certificate, especially from state to state, because there can be state requirements too, and the state requirements haven't changed. So I think it's important to always travel with a rabies certificate, especially throughout the United States.
Just to be clear,
Yes.
doesn't the CDC receipt form require a veterinarian to verify the microchip?
It does not.
It does not. So that was just the USDA portion.
Right.
Okay, so it does ease things up quite a bit.
So,
Yes.
but, and remind me that, because I don't have it pulled up, that the CDC dog import form, does it have, there's a part where you have to say that your dog is vaccinated too, right? Because I can't find, because we
No.
heard something about a verbal attestation, and I don't know where that is now.
So the first part is about the person importing the animal. Second part is animal information. And then section D is the signature, and you are attesting. So I acknowledge there is additional requirements that must be met if the dog at the time of entry for dogs that have been to a high-risk country. I understand the CDC reserves the right to request additional documentation verifying the information upon arrival to the United States. I understand that any false statement made in connection with the application subjects me to criminal penalties, and I will comply with all applicable CDC import regulations and requirements. And that's it. There's no vaccine.
Yeah, I think it was
portion.
the new piece on the website that you were reading that said something about the verbal or written attestation. And so I think the question that I think what's important is that if a dog is returning to the US from Canada because it's retired, I think it's just really important to make sure that the person who's turning the dog over to us can share with us the rabies certificate, like even if it's just a regular old rabies vaccine certificate, so that when we get to the border, if questioned, we can say, yes, this dog's vaccination is current. And then if not, then I guess we'd have to make arrangements to get the dog vaccinated. I don't know what you think, Dr. Quigley.
No, absolutely. I think that there should always be a valid rabies certificate when traveling, especially into the United States. You know, there's always state requirements for animal transports. So as long as you have a rabies certificate for a dog, you'll meet the state requirements.
Timeline on getting that form completed?
The CDC form is good for 6 months.
No, on getting it completed. So once you submit it, weren't they saying 10 days
No, they send
No.
you get an emailed receipt.
immediately?
It sounds like you would get a electronic receipt as soon as you submit.
Okay.
That's my understanding too.
All
That's
right.
just
So,
for the CDC form. The USDA form is you want that at least, 10 days ahead of time.
so for our listeners' sake, we're having these conversations in front of you because this has changed so much in
Today.
just in real time here.
Right.
So, are we good to go to Q&A for people?
Yeah.
Everybody? Yeah.
I think so.
Yeah.
So, folks, the questions today, we want them relevant to international travel with guides, and we realize that everybody's passionate about the subject, but please confine the questions to the regulations at this time, and let's not comment about guide dog handlers' rights and such, because we're going to keep working on this and make this right. Sandy, could you go ahead and tell everybody commands and how to raise hands and so on, please?
Sure. Good afternoon, everyone. So as a reminder, Alt-A is to mute and unmute. Alt-Y is to raise your hand or lower the hand. On a cell phone, it's *6 to mute and *9, of course, *6 to unmute as well as to mute, and *9 to raise the hand. We'll take the calls based on the questions, the numbers that have been there. So Kristen Dockenflorf, I am going to allow you to talk. And you should be able to unmute yourself now.
Well, thank you. I didn't know my hand was raised, so what a blessing. I actually just got back from Portugal a couple of months ago and wrote a little story about all the things you're exactly talking about and the amount of paperwork involved. And if you do plan on traveling internationally, there's a lot of planning involved. So to hear all these changes happening literally minute by minute, it kind of freaks me out a little bit about wanting to travel and wondering if this is something that's going to settle down at all and we should just wait a little bit or just get right to filling out those forms. Thanks.
My answer to that would be that there's a lot of people, Kristen, who travel for business who don't have the option of waiting. So they're going to have to go ahead with their lives and do what they've got to do. Those who are traveling abroad and looking down, into the distance, you can start planning and see how things unfold here. I guarantee you we're going to keep everybody updated as things arise, because literally we check the CDC website daily throughout the day, because we had heard rumblings that there was going to be a change today, but we didn't know when that would be. So happenstance as it is, it was just before this webinar. So so stay tuned. We're going to keep everybody updated on how things change. Accessibility is something that's a big, something to hang our hat on there. That form should be accessible.
Okay, so our
Next
next
question, Sandy.
question is going to be from Deanna Noriega. You can unmute yourself now, Deanna.
Okay, here I am.
Great.
I traveled extensively in Mexico, Central America, South America, and the Caribbean for business for 6 years when I ran a small business that was based on fair trade crafted items, handcrafted items. I've dealt with companies for Africa and India, Pakistan, organizations that were in the fair trade business. So I did have suppliers, but close in, I like to go find my own craft producers and look at what they had and then buy that way. So this health certificate we have to have in the US, and we should have it whenever we leave the country. It's not that hard when you need to do this for business to go ahead and do a quick check and see who in your area is a veterinarian that is on the list and qualified. Fortunately, the vet I have here, I only made some personal trips after moving here to Missouri, but she was, so it was not a problem. And while I was operating my shop in Colorado Springs, I specifically looked for a vet that was before choosing my vet, because I knew I was going to be going into an international business situation. And so that is just common sense to go ahead and set up everything in advance. Another tip that I would like to give is that I had great help from the Seeing Eye in that if I were traveling to a country with a different language, I would get a translated letter that explained what a guide dog was and why it was to their benefit to let me use my dog in their restaurant, hotel, shop, whatever, because if I was safer, then they were not liable, because my dog would keep me from falling downstairs, knocking over fragile displays, and therefore their liability was lower because he was a professionally trained. And I would use a term that they understood. In Mexico, I tried to do the translation, pero guía, dog that guides, but that caused more conversation than I wanted to get into. So I chose lazarillo, which was a term that means a guide. Just a guide, a fishing guide, a hunting guide, whatever kind of guide that you might have hired somebody to show you around. And that went over very well, and and I sent the letter to the training department and got the signature of the training manager, and he affixed a fancy sticker, a circular sticker with the Seeing Eye logo up at the right-hand corner, so it looked like a government seal of some kind. And
Hey, Deanna, it's Melissa. I'm sorry
Yeah.
to interrupt you, but I just was wondering if you had a question.
No, what I was going to say was just that it does pay to always, when you're traveling international, find out what the laws are. And Melissa can help you with some, your vet can help you with some. There are websites you can use, but don't ever go assuming that you're covered by American law, because you won't be.
Well, and it is important to do your homework, right? So we
Yeah.
encourage people to go to seeingeye.org/access, or you can go to seeingeye.org/advocacy. Either one works. And then from there, you can go to our international travel page, and that guides you through what you need to do to figure out where you should start. You know, this is not something, sometimes we get calls from people and they say, I'm just going to use Portugal since it's been discussed. I'm going to Portugal. What do I need to do? Kind of like we will just have a little file that says, oh, for Portugal, you do this kind of certificate, so on and so forth. Things change a lot. So we just immediately direct people to find a USDA accredited veterinarian to start with. There's a link on our international travel page to do that, where you can look for one. And then to look at the CDC, the USDA travel page on there's drop down menus depending on which country you're going to look at the requirements for your country. So the USDA accredited vet is always your first step, and then that is your other step to make sure that you are aware of what you need to do, what you need to have. But the point is very well taken. You've got to do your homework. We can help with some things. We cannot do everything for you. And if we could, we would, but we can't. So but we do try to provide the resources.
And I just wanted to reiterate that from what Deanna was saying, that because she did mention some higher risk areas. You still can travel to high risk countries, but there are additional requirements. And as Melissa was saying, you do need to find a USDA accredited vet, months before you travel, to make sure you start getting everything in order so that when you do travel, you can also get back into the United States.
I'm going to jump in with a couple questions that wound up in the chat. We didn't intend to do that, but that's okay. One question is, just to be clear, I need a CDC dog travel form and international travel form. Where does veterinarian come into play that is accredited by the USDA? Are you saying my vet might be a USDA accredited veterinarian? And how do I confirm the status of my vet? You want to do that, Kyle?
Sure. So so not all vets are USDA accredited. They choose to be or choose not to be. So you can either check to see if they are through the USDA website, or you can simply just ask your veterinarian if they are USDA accredited to fill out international health certificates. And that's where the USDA accreditation comes into play. So if you are going to a high-risk country, or if you're going almost anywhere other than Canada, you'll need an international health certificate. And that has to be filled out by a USDA accredited veterinarian. The additional
and endorsed by the USDA, right?
Correct. So this is where, as Dave was mentioning, the 10 days before, that's where all of this comes into play. The USDA accredited veterinarian needs to fill out this form through a USDA secured website that only USDA accredited veterinarians have access to. It's submitted electronically, but you will need to receive a paper copy that's endorsed before you can travel. So there has to be enough time for that paperwork to be approved and then mailed out either via FedEx or however, and arrive back to you in time for travel.
And to be clear also, because I know this question's going to come up, the veterinarian filling out those forms, the USDA forms, is going to charge you for them. Number one, that's a service they're providing, and we know that can be expensive. We've gotten prices $300 to $800, $300 to $800, but that person examines the dog and has to confirm the microchips. So a seeing eye veterinarian cannot do that for anyone. It has to be the veterinarian you're using in your home area. Am I correct?
Correct. And if you're traveling to a high-risk country, additional forms now apply. The USDA accredited veterinarian that vaccinated the dog is also going to need to be the one filling out the form, or at the same practice. So the dog may need a booster depending on the last time your dog was vaccinated, and if that vet was USDA accredited. So that's part of starting well in advance, is to to give you the time to get all that sorted out.
And other than the CDC form, Dr. Quigley, is this any very much different than it used to be traveling out of the country to?
The biggest differences now are
Iris.
getting back into the country. So you'll need the international health certificate based on the country, the destination country you're going to.
Right.
So if you were going to, say England, or Ireland, you're filling out the
Therefore.
USDA accredited veterinarian is filling out the international health certificate for that specific country, making sure everything's in order for you to arrive safely in that country and be admitted into the country.
And that's not new.
That's not new. That's staying the same. I don't know of any other countries that have newer regulations than this, that have any recent changes. But the US changes now affect the paperwork required to get back into the country. So you'll need the CDC import form for no matter where you're coming from to get into the country. In addition, you'll need additional paperwork if you're coming from a high-risk country.
All right, we have another one that was in the chat, and it's somebody who came in late. And I think we might have answered some of her questions because she asked, number one, what is the USDA form? So we've gone through that. And it says, I'm interested in US, Canada travel. A rabies certificate had always been required. Is it true that there is no vet form required for US, Canada travel now? Big deal in Canada, national news. So yeah, it all changed fast, but.
Yeah, so as of today, it looks like the CDC import form, and then, as always, just make sure you're carrying your rabies certificate information with you.
So the big takeaway here is that no matter what country you're coming back from, whether you're flying or coming by land or sea, that CDC dog import form receipt is going to have to be in your hand. So you got to do the CDC dog import
the photographs,
form.
right?
Yes, regardless of where you're coming from, how you're coming from there to the US, and you can use it for 6 months as long as you don't go to a high-risk country within those 6 months. But so there's, and there appear to be some accessibility issues right now, but we're hoping that those will be ironed out, because then that will really be sort of a game changer. So if you're somebody who lives in Niagara, New York, for example, and you are going to and from your family or your business or your relatives, or God forbid, you just want to do some shopping, because people with guide dogs just like to do normal stuff like anybody else. Then once you have done your CDC dog import form and you have the receipt, as long as you don't go to a high-risk country within 6 months, you can use that receipt again to get back home, show it on your phone. But then if you either do go to a high-risk country within those 6 months, or the 6 months are up, then you got to do the form again.
Yeah, and that applies to all ports of entry. But if you're traveling by air, you always want to check with the airlines as well, just to make sure that if they require the DOT form or anything else, that it's all submitted according to their policies and procedures.
And the unfortunate thing is that, and we're going to think positively, but we can't predict that things are all going to be clear. When the DOT forms came out, there was a little bit of a lag in terms of training of employees at airlines, understanding what they were allowed to do and not allowed to do. So it's very possible that that will happen again for a while. So we can tell you what the regulation is and the developments. What we can't tell you is we can never predict how these things are going, whether things are going to be applied correctly, but we can hope that they will be.
The photographs that are included in the form, once you've taken them, you should be able to save them and reuse them. If you re-up the form, you'll still have the photographs, but they do involve multiple people. It is the dog's teeth that you are taking photographs of, folks. It's not a beauty shot. This is you exposing the dog's dentition. They want to see the dog's frontal view. So you're lifting their upper lips and pulling their lower lips down to show their front teeth, and then doing a side view as well, 2 different shots. And don't get rid of those pictures in your phones once you've got them or once someone has taken them for you. Okay. There's one more question in the chat, and it was about this applying to cruises and ports of call in high-risk countries. Absolutely.
Oh, yeah.
And we have had many people who cruise and they need separate forms for every single destination along the cruise, depending upon what the island destination might ask for. We have had some grads choose not to take their dog because of that. Also choose not to get a form for a certain destination because they just agreed to stay on the boat than jump through all the hoops that it takes to get off of a boat in a certain location. So you should know that. Any other questions in there?
We have Margie. Margie, you can
Hey, Margie.
you can unmute yourself now. Margie D.
Still muted, Margie.
Maybe we'll go to Suzanne, the next one, until Margie gets her unmuted. Okay, so Suzanne Ament.
Suzanne?
You
Suzanne,
can
you're
unmute
also
yourself
muted.
now. You can unmute yourself now.
Hi there.
Oh.
Sorry about that. I got messed up with a locked computer.
Okay.
My question is about the dog import form and the microchip. Does the microchip number have to appear on that form? And if so, what's the easy way for us to get the microchip number? Do we have to go to our vet? How do you do that?
So the microchip number is always going to be on your health service certificate from us.
Okay. It's been a couple years since I've been there, so.
Yeah, so that's probably the easiest way if you have that either electronically.
I think I hear the phone ringing now.
So it can always be scanned. So if you're local,
So a vet could scan it, or
yeah, they can scan it and give you a copy of the number.
But that is required on the import form itself?
Yes.
Yes.
Okay. Okay, I just wanted to make sure because we're supposed to fill it out ourselves and we have to think of that ahead of time.
Correct.
Okay,
Thank
great.
you.
Thank you. Margie,
Hi,
I believe
it's
you're already
Margie.
unmuted.
Thank
Yes,
you.
Margie.
Yeah, thank you so much. Just a comment on the last speaker. I was there 2 years ago and all my veterinary forms were emailed to me and it's right at the top, so it's fully accessible depending on when you went. I want to thank the 4 of you, and especially I want to thank Dr. Quigley. I'm a 43-year graduate and I've never seen a vet get on the call with a bunch of graduates. I really want to commend you and your dedication. I have a couple quick questions. I understand the process, and my conclusion is if I'm going on vacation, it's just not worth the pain in the butt to take my dog, but I'm not a work traveler. And I have left the country a couple times and haven't taken my dog before things got worse. But my question is this. Going back to the 508 issue, if I understand, there's a 508 issue with these forms because these forms would have had to been contracted out for it to fall under 508 and not 504. Has Seeing Eye taken a stand by writing a letter of complaint or anything regarding the 508?
So Margie, I can't go into details,
Right.
but we are taking the steps that we are able to take on that, and we will see how things develop.
And thank you for that. And would it be helpful if some of us graduates wrote letters as well?
I think that if you are having a problem with the form, you can go to the HHS website and file a complaint against, you can file an Office of Civil Rights complaint against the CDC.
Well,
Or
I
you
actually
can
know
file
the
a 508
508
complaint.
coordinator for Health and Human Services. Actually,
I'm
know
sorry?
him. I happen to know the 508
Okay.
manager for that,
Well, then I
that
think
governmental
that
entity.
here's what you could do. I think that you can reach out to the person,
Mhm.
raise that issue. We like when people are well connected. And if you'd like to share the contact information of that person with us, that would also be appreciated. So
I will
feel
look at
free
that.
to
I will
email
do
it.
that. Yeah.
Thanks,
He's
Margie.
excellent. The other thing I wanted to ask, and I'm sure we all on this call are feeling quite the same way as handlers of seeing eye dogs. It seems like our rights are getting more and more and more eroded. And it seems like our rights are getting eroded due to people needing to fly with their pets or buying pets overseas or whatever. I'm curious, and I don't even know if this is in the privy of the IGDF, but I'm wondering if it is in the privy or the IGDF, and I don't think cuss dogs are around, but I don't know, that our professional organizations may want to try to take a stand to exempt all guide dogs from IGDF certified schools.
Yes.
We've attempted, we did that. We reached out, the International Guide Dog Federation did that, reached out to the CDC, asked for an exemption. So did Assistance Dogs International, and I'm on their committee and I can attest
Right.
to that.
Okay.
Those requests have not been honored.
Would it do any good to try to pass federal legislation?
Well, that is another conversation
Okay. You
that
and
I
I
don't
can
think
have
we
that
can have right
offline.
now.
Thank you.
Thanks.
I will go
I
back
just
on
want
mute.
to, can I mention one thing, Melissa?
Sure.
Oh, absolutely.
So I've been opening and closing this CDC import form all day. And it now looks different. So
Okay.
so section A is regarding the person importing the animal. Section B is the animal information. There is no current box for microchip number, but they require a microchip. So I think that might just be an error on their part. But it might be coming. And now the section C, which is travel information, would not load before. It's now loading. So it just asks for air, sea, or land, and then the country of departure and the arrival date. But that did not open previous times I have opened the form. So just to give
So
everybody a
here's
heads
what
up.
I'm going to propose here, folks, because we're an hour into this. I know there's still people to ask questions, but I think we're not going to have all the correct answers today as things are changing. And we will promise you a blast, an email blast to everybody with updates as things settle down and we get into this more. Don't you agree, Melissa?
Absolutely. And I want to be very careful here. And the concerns that I raised about usability and some accessibility problems with the import form, I think that I will make sure that I say that was before this webinar. It was like, not after 1 p.m. I really want to make sure that I am clear that what I have said about the issues with the form are the last time I saw it, which wasn't very long ago, but it's changing minute by minute. So I also will revisit the form to continue checking into, at least from my perspective, with my skill ability, how usable it is. And also we should be testing it on our phones too, because some people will fill it out on their phone as they're getting ready to cross the border.
Mhm.
So thank you for that, Dr. Quigley, that it's continuing to change. But yes, we'll do a blast with updates for sure. And it might be a few days because I think we want to let things settle down a little bit.
So
Okay.
Sandy's asked that if your question's been answered already and your hand's still up, could you drop that down so we can get a realistic idea of who's in the queue? And Sandy, give us another call
Sure.
while you're at it or another question.
So, Kiran Kaja, you can
Yep.
unmute yourself now. So the thing is, we have already may have answered your question through the answers of the other people's
Right.
questions. So if that has happened, please just lower your hand. So Kiran,
Hi,
feel free-
Karen.
There you go. You got
Hi
it.
there.
Hi, good afternoon. Very quick question. You've answered most of my other questions. So the USDA form is not required only for Canada as of now. Any other high-risk country, we still have to do. Or any other low-risk country. I cannot recall if Mexico was low risk. I still need to go, other than Canada, the USDA form is still required.
So wait, let's back up because you say USDA form. So we're talking about, because the USDA does come into play for international travel, so that's why I'm being nitpicky here. But the
Yeah.
CDC dog import form to come back to the US, you got to do no matter where you're coming from. High
Correct.
risk, low risk, land, air, sea. But I don't think that was your question.
You need
No.
to check with the country you're traveling to see what forms they require.
Well, you're with your
Specifically.
USDA vet.
Yes. Oh, okay. So the USDA form is only for exiting the country.
When you
Well-
say, okay, so your international health certificate, your
Mhm.
international health export certificate for the country you're going to, what is needed for that will vary by country. And that is why you want to connect with a USDA accredited veterinarian here to make sure that you meet all of those requirements, that gets filled out, sent to the USDA, endorsed by them, and comes back to you in hard copy before you go to whatever country that is. That has really not changed. Like
Got it.
all of this stuff is that's new, is just about coming back to the US, and coming from high risk countries. There are more hoops than there were before, and I would have to defer to Dr. Quigley on that part.
So my question then is, if
Yeah.
it's a low risk country and I'm coming back from the into the US from a low risk country, I just need the CDC form. Is that correct?
Correct,
Oh.
and your rabies information
Got
or
it. Okay.
anything else required by, if you're taking a flight by the airline. If you're coming back from a high risk, so the USDA has several different types of forms. So there is the International Health Certificate that is required by your destination. But there are additional forms the USDA accredited veterinarian will need to fill out for you to get back into the country as well. So, yeah, there's a couple different forms that'll be needed.
Mhm.
All can be taken care of by your USDA vet. And then
That hasn't changed from before though, right? Even before
it
this
has
regulation.
changed. So say you were traveling to South America, you would need your international health certificate
Right.
based on which country you're going to. But now if say you were going to Colombia, I believe Colombia is on this high risk
High
list.
risk, yeah.
It is.
So to get back into the country, now you will need the USDA accredited veterinarian to fill out a form
I see.
that is stating that your dog was vaccinated in the United States with rabies that was approved by the USDA.
Got it.
And that form is also filled out online by the USDA accredited vet.
Got it. Okay.
Yeah, not by the owner. The CDC one is the only one that's done by the owner.
Okay, great. Thank you. That's all I had to ask. And
Thank
I know
you.
it's changing every day, so I'll keep an eye on it.
Thank you. So let's go now to caller. That's 151-851-2351. Sorry, the phone number. You can unmute yourself now.
Hi, it's Mary Beth Metzger. I'll make this quick. Thank you so much for having this webinar. And my understanding was that Canada always had, unlike the U.S., where we have a 3-year rabies certificate, that Canada is a 1-year certificate. And just a question, that's still the rule. Am I right about that?
Oh boy, Kyle, do you know about that? 3 years versus 1 year in
I got
Canada?
nothing.
Yeah, so it's so the duration of a rabies vaccine is decided on by 2 factors. One is the manufacturer of the rabies vaccine. A lot of them make 1-year and 3-year vaccines. So you have to have either the 1 year or 3 year vaccine administered. And then the other thing would be either the country or state that is issuing the rabies or that the rabies certificate is being made in. So some US states don't recognize 3-year vaccines. Canada may have their own policy regarding rabies vaccine only being a 1 year. But I can't say for sure. Different
Okay.
countries have different
Thank you so
regulations.
much.
Yeah.
Thank you.
Right.
So, yeah, I'm pretty.
Oops, I'm sorry. I am you now. Thank you. And we'll go to Joy's iPad. I'm allowing you to speak.
Hi, this is Joyce Feinberg. My question
Hi,
is,
Joyce.
hi, Melissa. What about U.S. territories like Puerto Rico, the U.S. Virgin Islands, whether you're flying or just cruising to just those areas, would the CDC form be required? We've spoken about Canada, but what about U.S. territories?
I don't think so. That's not, I haven't read the
Dr. Quigley
territories.
is searching in real time. I see on his computer.
Yeah, go with him. Just because I'm saying that, you know, that
And
was something I thought would come up, but I thought, oh, that's easy. No, not for US territories, but we'll defer to the expert on that one.
And while he's searching, I will give an answer to the last question. Somebody just wrote in and said that they got a 3-year rabies vaccine in Canada. It might depend on
Provincially.
Provincially and what your veterinarian's using and so on for vaccine. Yeah.
You can go on to another question or whatever while he's looking it up.
Okay.
Thanks, Joyce. Okay, great. So we'll go to 12067551545. You can unmute now.
Can
Got
you
it.
hear me now?
Yes. Thank
Hi,
Yes.
this is Kathy Taylor. I have a question. So my husband and I, he and I go to Canada quite often, and I'm in between dogs right now, but this could affect others too. We have Nexus passes, so to go through the pass lanes. And so have you, and any of the things you've read in terms of going back and forth between Canada, I guess one could call the Canadian border people and ask them this, but I'm just curious if you've seen anything about whether fast lane, kind of fast access to get through the border crowds, can they handle these forms, or do you have to go through the slow boat lanes?
I think we're gonna find out. I don't think there's an answer to that yet.
I don't know the answer
I
either.
think you're gonna
I
have to
haven't seen
try
it.
and report back to us.
Well, I need to get another dog soon, but yeah, I was hoping that maybe I can call and find out and let you know. Actually,
That might be best because I
it
don't
just
think the
may-
regulation really addresses that. I think it's just about how the CBC people are gonna decide to apply it, that aspect of it.
Great.
Okay.
Thank
sounds
you.
Good. All right.
Thank you so much.
Thank you.
Okay. Quincy, you are allowed to now unmute.
Okay, my question is very quick as well. So I have dual citizenship between Canada and the US. And I'm wondering, when traveling back and forth, obviously like for the importation form, is it better to put the US passport number or the Canadian, or does it matter? Or do we know yet?
I think it matters. I think because you have some choices. You can either put your passport number or you can put your driver's license number. You know, I was playing around and tried putting my state ID number in there. So I would argue that it doesn't matter. You have 2 valid passports, and I think you could put either number.
Okay, thanks. That's all.
Great. Thank you, Quincy. Okay, we're going now to 12066, unless Dr. Quigley found the answer.
I did find so Guam and Hawaii have additional requirements local requirements. So you want to check Hawaii and Guam if you're traveling there. As far as Puerto Rico, I have not found anything as far as additional requirements.
Puerto Rico doesn't have, to my knowledge, doesn't have any to go there, but I think unless I'm sorry if I'm overstepping, I think the question sounded like it was
Right, to get back.
coming back here.
I haven't seen anything specific to Puerto Rico.
I didn't either when I was looking through all this, because that was a question I had too.
Okay, so 1206751, you can unmute yourself now. I guess. There you go.
Yeah,
we
this is
can hear you.
Kathy Taylor. This is Kathy Taylor. Can you hear me?
Yes.
Yes.
Okay, you already answered my question, so you
Okay,
can,
great. Thank you.
ignore me.
So
Yep,
thank you,
thank you.
Kathy. Okay, Rick Blair.
Hi, this is Rick Blair calling.
Hey, Rick.
Hey, how you doing?
Good.
We haven't
Rick
spoken
never
in a-
travels internationally. Just kidding.
Oh yeah, I frequently travel internationally, and I will tell people that almost 90 to 95% of the time, I'm stopped in customs coming back into the U.S. asking for the rabies certificate. That's been going on for at least the last 5 or 6 years.
Sure.
So I always just have my rabies certificate in the pouch on my dog's harness. So I always have it present. And you can do the same with some of these other forms. And the Seeing Eye sells one of those pouches. Sorry for the plug. My question, someone earlier mentioned the fact that my vet can electronically submit the health certificate form. And the last time I traveled was only in April to France. And my vet still had to submit it via paper with the slow, basically via mail, and then, get it back via mail. So is that new that they're going to be able to electronically submit it?
Yes, the whole electronic submission site is fairly new. They're getting away from the paper documents, but depending on the destination country, there may be paper documents that have to be uploaded into the electronic system. And then again, once it's submitted electronically, they have to print it, emboss it, sign it, and then mail it to you. So that extra amount of time is still needed.
Well, and extra expense because you're paying for fast delivery because they need it within the 10-day. Yeah, I know. FedEx gets rich. But I'm glad that that at least by electronically submitting, I'll test that next time I go to France or Germany or somewhere in Europe. So cool. Thank you very much.
Might cut down a little bit of the time as far as
Thank you, Rick. We're going now to Christelle.
Hello, this is Crystal. I have a quick question. I am a Canadian, so I understand I have to fill the CDC form if I'm going into the United States, correct?
Correct.
Yes.
Okay, if I'm going to another country from Canada and returning to Canada, I do not have to fill the CDC form?
Correct.
All right, that was my question. Thank you very much.
Thank you, Crystal. Jonathan Scharf, you can unmute now. There you go. You're in. Jonathan? We were able to hear you for a few seconds.
I don't think he's.
Sorry. Okay, well, going to leave you that way, and we're going now to Victoria Post. Victoria.
Webinar menu drop down button, more meeting control.
Okay.
Hey, Vicky.
Yeah, hey, I'm not sure this is unmuting.
Yes, we can hear you.
Thank you. quick question. If I'm going to several EU countries, can I fill out the dog import form ahead of time? Or do I have to fill it out when I'm in the country that I'm departing from?
You can fill it out from the country you're departing from. I don't know. I don't know if they have any way of knowing.
I just wondered if I could do it before I left here. Well, it's easier.
You could, as long as you know exactly when you're arriving and which country you're coming in from. The only,
Yeah,
if you are going to a high-risk country, it changes everything.
sure. Yeah, but in this case, I'm not, but yeah. Yep. Okay, I was just hoping to avoid having to
You
do
just have to know that
there.
if you change your travel plans at all and you end up arriving on a like your flight gets canceled, or you decide you're gonna switch it up and come in a different day, then you would have to do it again.
Yep.
Great. Thanks, Victoria. Jonathan, we're going to try you one more time. Oh, there you are. Perfect. Jonathan?
Oh,
It's not.
he's
I thought I
coming and
heard him.
going.
Yeah. So Blaine, we'll move back to you. Blaine, you can unmute yourself. And we only have one more question after this.
Hey everyone.
Hey, Blaine.
So with the picture part of it, so they want to see my dog's front teeth, and then you said the side. Is that his head, or what exactly are they looking for?
The
It's
teeth.
dented. Yeah, go ahead, Clau. Sorry.
Oh, no, yeah, I was just saying the same thing, that they're looking at the teeth, so the dentition from the front and from the sides.
Okay.
Yeah.
And
And
that's
how clear
uploaded.
do you think the description is, Dr. Quigley? I've read a lot about photos of your dog, but it seems to me that does the CDC website that changes every 2 seconds describe in more detail so that if you're like using a screen reader and
No.
you're not looking at the pictures, right?
It doesn't do as good a job if you're visually impaired. It is a 2 photographs showing you what they want to see, and I don't know that there's a lot of description.
I
but
don't
they
think there's
want a
any
front
alt
and a
text
side
because
view. Yeah,
And
of the teeth. Am I
it's
right, Clau?
interesting. I'm not able to.
C920 right there, and it will now be used.
I'm not. Oh, here we go.
You're done talking, so you'll lower your hand in 8 seconds.
So Jonathan, we can hear you now.
Hi, you can hear me now. Yeah, my
Now lower.
guess the vacuum hit the cord on the back of the computer, kind of ripped it out. I had to reconnect it. Sorry about that.
And I'm just going to say thank you, Blaine. I'll just move you out. Thank you. Okay, Jonathan, you're up.
Yeah, great. Thank you. First of all, great presentation. Give me a lot to think about. One comment and then a question. Comment would be, given the fact that we got the CDC, the USDA, and airlines involved, I've found in the past that, if you ask 2 people, you get 6 or 8 different answers on what it could be. So there's a lot of perhaps stuff in motion as you did. I would dare to say it'd be probably good to triangulate the information if there's any questions, to reach out to the consulate general of the respective country that you were doing, and they'll definitely know the requirements on the visiting country side as well. That'd probably be good information to have. My question to you, I was a little shocked to hear about the need for airway bills, or by sea. I'm sure it would be like a bill of lading, an ocean bill of lading or something,
Yeah.
which is usually associated with cargo. And I once, when I lived in Singapore, I brought our dog home, and this is many years ago, but I had to get a third-party company to arrange cratage and bringing him back, and he flew in the cargo section of the airplane, and he was quarantined when he came to the United States. Do you think there's any chance of the dog being the guide dog being quarantined upon return to the
So what I would say to that, Jonathan, is 2 things. One, as of today, we learned that airlines are allowed to apply for, and I don't know, that's a good question about cruise ships and cruise lines about whether they can apply, but there is, at least for airlines, an exemption available that they can apply for to not do the airway bill, so that won't be an issue. But your
Okay.
dog's not going to fly. We would never advise anyone to fly their dog in cargo, and there's not been any indication that the dogs would be quarantined for any reason as a result of this. I don't know if you disagree with that or have thoughts on that, Dr. Quigley.
These forms are so that the dog does not have to be quarantined.
Okay.
If you were to arrive from a high-risk country without the correct paperwork, that would be a risk. And the dog could be quarantined at, the CDC quarantine site of their choosing. So all of these forms are designed so that the dog can enter the country safely and not have to be quarantined.
That's good to know. Yeah, that was a traumatic experience for my dog, but this was a number of years ago, and
Yeah.
I swear he was never quite the same after being quarantined for a couple of
Okay.
weeks. So
Yeah, we don't have to. That's a lot. We're sorry that
Yeah.
happened to you. Thank you for
anyhow,
sharing.
thanks for your guidance. I appreciate it.
I just
Have a
want
good
to
one.
say that, just like Dave and Melissa had already mentioned too, is that this CDC import form is definitely in a state of change. On the CDC website, it talks about the photos of the dog, and saying that it's showing the face and body, although the demonstration that the examples were of the teeth and the dentition. It says that you have to make sure to enter your dog's microchip number accurately on the form. Right now, the CDC form does not have a place to enter the microchip number or a place to upload the photograph. So I think they're making changes, and I'm sure there's going to be some changes before August 1st. So hopefully this all gets ironed out in the near future. And as Dave was saying, there could be an update in the coming weeks. So.
Okay, and our last question for today is from Milena. Milena, you can unmute yourself now.
Hi there, Dave, Melissa, Jim, and Dr. Quigley. Kyle, thank you so much. It's Milena from Nova Scotia, Canada.
Hey there.
Hi.
Thanks so much
Hi.
for doing this. My heart goes out to all the hard work you guys always do for our seeing eye dog protections. I basically have a question on the rabies itself, actually, more pertaining to Dr. Quigley there. The dog specific one, if I've misheard you, forgive me. The U.S. has eliminated, you said, the dog specific rabies. Is there a number now showing that this specific rabies has come back in and is spreading? I'm curious just for that. And then I do have another quick question after that pertaining to rabies.
I believe this is all in an effort to make sure that the dog rabies variant does not get a foothold again in the United States. To my understanding, it is still considered eliminated from the country, and this is to make sure it does not start spreading in the country. There's there's fox rabies in certain parts of the Southwest. There's bat rabies almost everywhere in the country. I believe it's skunk rabies in the West and raccoon rabies on the East. But as far as that variant of rabies, it's been eliminated from the U.S. and this is all in an effort to make sure it doesn't come back.
Understood. Okay. And then fatal, your words were fatal to dog and human if bitten by this specific?
Correct.
Okay. And last but not least, just out of curiosity, now coming into Canada, we have a lot of dogs being imported from Texas. I'm acquainted with some people. I kind of don't want to go there, and heartworm is making its way over from the dogs from Texas, and a lot of the dogs coming into Texas are coming from the high risk rabies countries, as you have mentioned on this webinar today. I guess if you don't have the numbers, are we risking? Because I'm pretty sure Canada is probably going to follow with something as well. Are we risking bringing in these dogs from parts of the States that are traveling via one country to,
Well, starting August 1st, no dog under 6 months of age can come into the United States. And then no dog coming in from a high-risk country can come in without the additional documentation and paperwork. So I think it'll be a lot safer for the dogs that end up in the United States to then travel on to Canada. So I think it should improve. As far as heartworm disease, that's always a risk, and there's certain ways that organizations can mitigate the risk of heartworm disease coming to their area. But yeah, that would be a conversation for their veterinarian.
Great.
I just want to add a little bit of levity here to this very distressing, serious topic that we've not distressing, but intense and fluctuating topic. My favorite question that I got from one of our graduates who spoke to me about the new regulations are, what are we going to do about the foxes running across the border? And I said, nothing. We're not talking about fox variant rabies. And last I checked, they don't have a lot of paperwork on them. So I just thought I'd throw that out there for everyone's.
Quite enjoy that, Melissa. And I just wanted to say that the reason I asked that question is, we, as in the U.S., we do have a dog attacks. So I'm always, on the lookout for who's got what dog from where. That is not probably accredited, and that was the reason for asking that question. Thank you very much. End of my thoughts. I wish everybody the best, and we're just going to hold still here and wait for the travel. Thank you so much.
Thank you.
I know we've cleaned
Thank
out the
you.
queue on questions, but there was one in the chat, and there was a question about what do they mean by markings on the form. They're asking if your dog has anything special for marking, like a white spot on its chest, or if it's a sable German Shepherd and has a black face, you could say that's a marking. It's got a black face or whatever. Or you have a yellow lab with a white spot on its chest, or a black lab with a white spot on the chest. That's what they want to know with markings. That's all. So I think that will do it for us, folks. We'll call this a wrap, and this will be available on our website towards the end of the week, and expect to see a blast from us with an update. I hope it's only one update when this settles down, but there's more to come, I'm sure.
And also know that if by the time you get the recording, it is out of date, remember this, it was recorded on July 22nd from 3 to 4:30 p.m. So if you find anything in this webinar that seems inaccurate to you, know that we, of course, are human, and this has been developing very quickly, but also know that it might have changed by the time you listen to the webinar.
All right. Thanks, everybody, and thanks for joining us, and have a great day.